Good evening, ladies and gentlemen. Welcome to another episode of Community Issues. As usual, we are back with your favorite fortnightly program. The topic for discussion this evening is diabetes in the community. Now, some of you may know this, that almost 1 in every 10 person have diabetes, and type 2 diabetes is very common in the community, especially amongst Asian people. Tonight we have a lovely lady in the community who's been providing a service to the community for a very long time. She's someone who's also worked in Bangladesh in the British High Commission, providing a nursing service to the British High Commission staff and their families, and also to a certain extent to the local Bangladeshi community. She's no one else but, of course, our one and only Helen Snowden, who is the lead nurse in the community. Helen, a very good evening.
Thank you. Thanks, Doris. I'm delighted to be here. Thank you for inviting me.
Thank you so much for making the time to come to my program. I know you have a very, very busy schedule looking after a patient from morning till the evening, and your work never stops. But despite all of that, you've made the time to come to my program at my request. I am indebted to you. Thank you for coming.
You're very welcome. Thanks for inviting me. I think it's really important that we are able to talk to the community in this way as well about diabetes, because it's so important to get all the health messages across.
Thank you so much. Now, Helen, you've been a lead nurse in the community, providing a service to the local community. How long have you been a nurse for?
So altogether I've been a nurse for 35 years now.
35 years.
Yeah, so a very long time. I have specialised more in community work over the last 20 years. And I've been very fortunate to work in Tower Hamlets for the last 17 years. 17
years in Tower Hamlets. Yeah. My God, that is a long time.
Yeah.
And I know for a fact that you work in a local practice here.
That's correct.
Which is not very far from our studio. It's only a stone throw away. Mm-hmm. So you know the local community quite well.
I would hope so by now.
Yes. If I could, first of all, well, before I ask you the question, let me let the viewers know that although this is a live program and we're having a one-to-one chat, if anybody wants to participate in the program or want to know anything about diabetes, please feel free to pick up the phone. There should be a number coming up on our screen, which is a free line number, so you can phone in and ask any questions about diabetes to Helen Snowden. She will be delighted to answer those questions for you and perhaps give you that tip that could be a life-saving tip. So please feel free to call in at any time during the program. So Helen, just for the benefit of our viewers, what is diabetes?
So I think the majority of people know that diabetes has a lot to do with sugar and sugar in the blood. So there's 2 different types of diabetes. So generally, most people in the UK have a type 2 diabetes. Now, type 1 diabetes is very much in a minority number of people, and that's caused at a young age where the body doesn't produce enough insulin at all, and that person is completely dependent on insulin. Whereas the vast majority of people in the local community are type 2 diabetics, which means that your body doesn't mop up enough of the blood sugar that's going around the body. So what happens, unfortunately, is that the sugar levels are very high in a person's bloodstream, which then results in targeting our organs such as the eyes, the heart, the kidneys, and can cause major damage to these organs. So that's why it's so important that we try to control the blood sugar, both in type 1 and type 2 diabetes.
So it sounds like quite a serious...
It's a very, very serious type of disease,
sure.
Which unfortunately results in people having much shorter life expectancy if they don't look after themselves.
If it's not looked after properly.
That's correct, yes,
right,
unfortunately.
Okay. Is this something that people could inherit?
Yes, there's
is
definitely.
Is it genetically inherited?
Absolutely.
Or is it something that people get as a result of their lifestyle?
I mean, it's a combination of many different things. So it is partially genetic, we know that much. We also know that it is lifestyle as well. So when people, don't do enough exercise, unfortunately, it's very much linked to obesity, and, people that are overweight don't take enough exercise. So a lot of it is that. Plus, we do know that sort of cultural, ideas, and also people's just general beliefs as well can have an impact, but it is a combination of many factors. So it's lifestyle, genetics, and sometimes, unfortunately, poverty as well plays a part.
Could stress also lead to diabetes as well?
Stress doesn't help anybody, I don't think, really, if it is out of control. So
but does it contribute to diabetes?
It doesn't, no.
No, it doesn't.
No.
Okay, that's nice to know. You've mentioned there are two types of diabetes,
right.
type 1 and type 2, and you've said that type 2 is very common.
It is, yes.
In the community. What are the symptoms of diabetes?
So a person can often develop diabetes type 2 quite slowly, so it's a gradual onset of the symptoms. So this can be often things like feeling increasingly thirsty. So you could feel very thirsty. You could actually start passing more urine, going more frequently to the toilet. Some people do lose weight initially, if their blood sugars are very high. So combination of weight loss, thirst, things like increasing infections can often be a sign as well. People get skin infections, things like thrush. These are all signs of the sugar being too high in a person's body.
Right. What about obesity? If people are too fat, could they also have diabetes?
It is definitely one of the factors that can lead to diabetes, and unfortunately people from South Asian communities are 6 times more likely than the general population to develop diabetes.
Really?
So it's a big problem.
All right. Well, I didn't know that. So you said the symptoms are thirst,
increasing thirst,
increasing thirst, going to the toilet quite often, losing weight.
That's right, yeah.
All can be symptoms of diabetes.
That's right, yeah.
If anyone that is watching our program and having these symptoms, what would your advice be to them?
It's really, really important to go and get a blood test with your local GP, because with diabetes, the sooner it's diagnosed, the more opportunity we have to help people, support people, give them the right advice. I mean, at some stage, sometimes people do need to take tablets and insulin, but that's not always the first line.
Sure.
And as with anything, with any disease, it's always so much better if you can catch things early.
Early stage, right.
And get support straight away.
Sure. So, in terms of blood test for diabetes, how many different types of tests are there?
There are 2 different types. So you can do what we call knee patient testing, which is where you just do a finger prick test.
Okay.
However, the more accurate type of blood test is one that's taken from the arm. So this blood test is known as a HbA1c.
Okay.
So it's measuring an average of your blood sugar over an 8-week period. So it's not just immediately what you've eaten just that minute, because a lot of people will say, oh, but I've just had a Mars bar. So it's more looking at the average of the sugar level over an 8-week period, and this is the important blood test that we really need to do.
Sure. Do people have to
you don't need to fast for
fast the night before to have that test done?
No, they don't.
No? Okay. We've talked about the symptoms of diabetes. What are the causes of diabetes?
So with type 2 diabetes, the main causes are obesity, so being overweight, the fact that people don't take enough exercise at the moment, having high sugar, high carbohydrate diets really have a big impact on it. Things like we mentioned about the fact that it can be partially genetic as well. Right. Some people have a genetic tendency towards that.
Sure.
So a lot of it is environmental, lifestyle and genetics, a combination of all those things.
What about cholesterol level?
So fat in the blood, the cholesterol level, does not lead to diabetes, but it leads to heart problems. So obviously it's not a good thing.
Okay.
And so often people that have high sugar levels, because of their lifestyle, may also have high cholesterol levels.
Cholesterol level.
Yeah.
What about blood pressure?
So blood pressure doesn't directly cause diabetes. Again, it's not good to have raised blood pressure,
Right.
and that can be another factor when people are having diabetes checks, that we always monitor their blood pressure, because that can lead to complications with the heart.
Sure. Well, thank you for clarifying that. My next question was going to be, how severe is this diabetes problem within the community, and especially within the Black and the minority community?
I mean, unfortunately, it's a massive, I would even describe it as an epidemic of diabetes, particularly in the local community where we have a high percentage of South Asian people. We also have, young white British people that are developing diabetes because of lifestyle. Sadly, younger people all the time. I often see sort of young people in their 20s now. So again, it's often due to their lifestyle. So it is a massive problem in the local community, I'm sad to say.
Can people get diabetes at any stages in their life?
They can, yep. So generally, type 1 diabetes is often diagnosed in teenagers, young
right.
children, and that is an autoimmune disease where people are completely dependent on insulin. So it's quite rare. So it's much more common for people to get type 2 diabetes starting in sort of middle age, but unfortunately, we're seeing people developing it much younger now.
What about people of, say, my age? At what age do you think, other than children, that people are likely to get diabetes?
To be honest, at any age you can develop diabetes, from sort of cradle to grave. So, we do see people, getting diabetes in much later in life as well.
Sure.
So, but commonly, type 2 diabetes is often sort of middle ages, sort of like 30, 40s, people start to develop.
Right.
And the sugar levels, start to be picked up at that age.
Can one live a normal life although they may have diabetes, provided it is controlled properly?
Absolutely, yeah. I totally think it's really important to put that message across that, if people get diagnosed, if they look after themselves, if they come to see their local diabetes specialists on a regular basis, whether that be at the hospital or in the local community, they can have a normal life. And I always try to remind people that we do have Olympic athletes that are diabetic. And
really?
yes, yeah. So it's just really important to get across to people, yes, it's a chronic disease, but it's a disease that you can live with and be healthy with and still go ahead and win a gold medal.
Right. Okay, I didn't know that.
Yeah.
So what are the stages that people need to sort of go through? For example, say if someone is diagnosed as perhaps being on the borderline or just over the borderline, what are the stages do they need to go through in order to get to a situation where you are treating that person, giving the appropriate medication and ensuring that they've received sensible advice and support, not just from yourselves, but from other partnering agencies?
Sure. So as soon as a person has a raised blood sugar, so we're now actually diagnosing people as being pre-diabetic, and there are some fantastic programs out in the community that are for pre-diabetic patients that help them to stop going over into diabetes, so we can actually prevent it developing into diabetes. So that's the first thing I would say, is to remember that there is pre-diabetes programs to support and help people. If patients become diabetic, they can get really good support from the NHS, from Diabetes UK, which is a charity.
Right.
They can also, from their GP, from their nurses. We have a fantastic local diabetes centre at Mile End Hospital, which is an NHS hospital. So I think the key thing is to get early diagnosis and then get the support with the dietitians and exercise programs and all the help and education that's out there at the moment.
Right. earlier on you said that diabetes is a disease that affects a lot of the major organs, and you said the heart. Does it also affect your eyes as well?
It does, yes,
Right.
yeah, unfortunately. So it's the major organs that it affects are the kidneys. So people often end up with kidney failure. The heart, so you can have heart attacks. It affects your eyes. So that's why in the UK we do an annual eye test on all diabetic patients for free. And then it can also unfortunately affect your circulation. So you can get people having problems with their feet, because it's furthest away from your heart.
Yeah.
So you'll often hear of people in countries where unfortunately they don't have an NHS and they don't have free medication, support and lifestyle, that they have to have toes amputated and this kind of thing. So it affects the whole body because your blood is going around the whole of your body.
Sure. So it's very serious.
It is incredibly serious the sooner
if
you
it
get.
is not controlled.
Absolutely.
Okay. Since we are in East London, and although this program is not just based in London, but it's a program that's been watched by people from all over the country and also from Europe and other countries in the world as well. I know that East London is very special, certainly to me and to many of the Bangladeshi community. How severe is this problem of diabetes in East London, bearing in mind that you've been providing a service for the last 17 years, and how do you compare that with other parts of the country?
I mean, I think it's a huge problem in this area, mainly because we do have a lot of people from the South Asian community, but also because it's a chronic disease. A lot of people get complications. So if people are not taking medication, not taking insulin, not looking after themselves, they can get all the other complications that go with diabetes. As we mentioned, heart problems, kidney problems. So it's it has a massive impact on not just the NHS, not just the health services, but it must have a massive impact on people that are living with it and their families, because there are all the people who care for them as well that it affects.
Sure. So, say if someone has diabetes and if it is controlled properly, I know you said that they could still go on and be the Olympic champion. They could live a normal life. But if it is not looked after properly and they haven't been to their doctor, if it hasn't been diagnosed, if they are not taking their medications, the effect of it can be quite severe. And you said that they could have things like heart attack, kidney failures, they could have problem with their visions.
That's correct, yes.
Is there anything else, in your opinion, that perhaps people could have as a result of not being diagnosed properly or not being looked after properly?
I mean, unfortunately, in severe cases, we do have people who have to have limbs amputated. So it does get to the extremes of, really serious problems, multiple admissions to hospital, and the effect that has on the whole community. Yeah.
Helen, I need to just stop you there for a moment because it's come to the moment where we need to go for a short break.
Okay.
So, dear viewers, please don't go anywhere. Stay with us. We'll be back after a short break. Thank you.